The therapist I've interviewed is Travis Gray. He graduated from Trinity International University and practiced as a counselor for 3 years now. He specializes on codependency, relationship issues, and addiction, treating many disorders such as parenting issues, spirituality, anxiety, bipolar disorder, and video game addiction. He said that he became a counselor because he always wanted to figure people and himself out. I set the interview in Learning Commons during sixth period by phone. Travis didn't want himself to be recorded, so the whole discussion I had to take written notes. During the interview, I just wanted to see what a therapist is like because I've never spoken to one in my life. Honestly, it seemed like a very fun and interesting experience in the beginning, but in the end I became really disappointed. When choosing a therapist, it's really easy to stumble upon an amateur, because any therapist can propagate any ideas, even the craziest ones, which makes a search process very important. The interview began with me asking questions about his approach, how he treats his patients, and what happens during the session. He seemed like a professional, using terms we learned in class, talking calmly and confidently, which made him seem like a very experienced and educated counselor. He uses an eclectic approach, meaning that he tries many different techniques to find one that will help the patient. When I asked about his treatment style, he said, I specialize in getting to the core of people's emotional pain, find the source of the problem and why they do what they do. Then I advise patients on how to solve them. When I asked about shy patients, he said that he uses humor and tries to share experiences. Then he told me about the comprehensive emotional memory assessment, the diagnostic tool that he created and now uses for diagnosing patients. Here's a quote from his website about it. The assessment works by evaluating the ways that we interact with the world around us and how we perceive others and ourselves, all of which is filtered through our schema and emotional memory. As he said, medications don't play a role in the treatment. His goal is rather to keep people off medications. At that point, it was clear that Travis was against medical model and medications in general. So I decided to start asking non-planned questions. I was curious that he does not accept the classic medicine and asked what it is that he prefers. He said that alternative medicine is the only one way that can help, and began explaining his reasons. In order to know how well the treatment is going, he uses a simple self-report. He said that he often notices when the symptoms get better, but, according to him, usually the client himself tells him if the treatment is working or not. Then, I've asked if he needs any medical information to begin treatment. He said, if somebody comes into private practice, there is only few things I need to ask. History in suicide or self-harm, or a will to kill someone. Then I asked what his criteria for determining whether a patient needs to be hospitalized, and he said that it's usually when a person is really decompensating, drunk or high. Whenever it's not safe for them to be around, he'll send them to a local psychiatrist. I also asked about the most frequent disorder and cause. According to him, the most frequent problems are anxiety, depression, relationship problems, and a deep disbelief in oneself, and the most frequent causes are chemical addictions. When I asked how he treats coexisting medical conditions, he told me that he's not much of a medical industry. He explained that the doctors don't go deep into the cause. They take care of symptoms only. He also stated that the industry is huge, but around 95% of patients return because the medications don't help. I search for the cause, mostly talk therapy, lifestyle change, changing the meaning and outcome, changing their beliefs. Next, I asked him about his relationships with other doctors. Travis explained that he can't diagnose anyone and doesn't advise his patients to go to doctors, but doctors can recommend a patient to go get counseling from Travis. The main problem with the medical model, according to him, is that people keep poisoning themselves with medications, while the God created our bodies so that they can heal without other help. After that, I decided to ask him the last question and end the conversation. I asked if there was a moment in his career that he wanted to quit because of something terrible he could see. He said, "No, not yet. I don't have a lot of expectations from people. I've been frustrated. I've heard stories that made me cry. It's hard to treat and manage children, but nothing for quit." Now, I want to tell some of my personal thoughts in this interview. In the beginning, Travis seemed like an experienced counselor, but as the interview went by, I started realizing how deeply religious and alternative he is about his way of therapy. Although I can agree that the person shouldn't just blindly try to stop the disorder using drugs, the alternative therapies still are not the safe choice. Yes, it can work for some people, but I assume that for most cases such an approach would be damaging. That's why people must be very careful when searching for a therapist. It's better to find someone who can balance medical model with classic therapy and even an alternative therapy, because without that balance, the therapy won't have a positive effect. If I read his website carefully before the interview, I would know about all of that from the beginning. Sadly, I didn't.